Hey guys, it's Joyce. I'm here today to talk to you about the Zoll Defibrillator. This is the one that we use here at Henry Community Health facility-wide. All the defibrillators are basically the same. A few have extra bells and whistles and a few have less. But overall, this is the standard model of defibrillator that we use here. Some basics about this defibrillator is it is called a biphasic machine, which means that both pads shoot energy to the heart, which is why proper placement of the pads is very important. The maximum joules is 200. You cannot make this go any higher than 200 joules. So if you look at my mannequin here, the pads, which I love, have this little device here that goes right on the middle, right at the sternum mid-nipple line. And if you put this pad on in the proper place, the triangular front pad will follow suit. Just make sure when you put it on that you push out all the air bubbles, because you want to have as much surface area contact as possible. And then you're going to take and turn the patient around to get the back pad put on. Just slap her on there and push all the air out. It is so important to have the pad this way because that is going to give you the highest functionality of the pads as possible. So our defibrillator pads come in two different sizes. The adult pads look like this. They have the triangular front pad and the square back pad. And then the pediatric pads have the smaller circular pad for the front and the same pad for the back. Both work the same, just obviously with the child, you want to use these pads. When you're doing your cart checks, always make sure that it wasn't accidentally hooked up to pediatric pads. I've seen that happen. So when you do your cart checks, make sure that you have adult pads hooked up. The Zoll also has this cable right here, which is called the multifunction cable. This is where your Zoll pads will plug in at. If we ever do choose to use the paddles, which most places don't anymore, the paddles also hook into here, but this is called your multifunction cable. All right, we're going to think about the defibrillator like you would a stoplight. It has three sections: the red, which means we need to stop those rhythms; the gray or your yellow caution zone, where we're just going to kind of watch and see what we need to do; and then we have the green section, which means go. We want to make that rhythm go faster. We're going to start talking today about the gray or the yellow watch section. You're not going to do anything to the patient on this section. You're just going to be watching them. When you turn it on, if you have the pads on the patient, it's going to come up in the pads look, and you're going to be able to see the heart rhythm. If you had the patient on the 3 leads, then you would have to change it into the lead setting simply by pressing the button that says lead. You can change the size up and down. You can record if you want to catch a rhythm that's going across. You can suspend the alarms. The most important thing is to remember that when you turn it on, make sure that you have it either in the pads or in a lead. You don't want to call a code because your defibrillator is saying asystole. Make sure that you do your flatline protocol and see that you have it hooked up correctly. So that's all you can really do in the watch section. The red section, or the defibrillation section, is stop. We need to stop those rhythms. There are 2 rhythms that can be defibrillated. Those are VFib and pulseless VT. When you talk about VT, you always remember to talk about if it has a pulse or if it doesn't, because those are treated extremely differently. So we're going to flip on over into the red stop section. When you need to defibrillate a patient, you're going to use everything in the red section. These defibrillators can also act as an AED, and you can just analyze it, and then it will tell you if a shock is indicated or not. We're going to show you both ways. If we have one of the 2 rhythms that can be defibrillated, VFib and pulseless VT, you're going to see it on the screen like this. When you turn it to defib, it auto sets to 120 joules. You can change your energy right here, going up or down, whichever your physician determines, and it says a max of 200 joule max because it's a biphasic machine. It will not allow you to go any higher. If you want to use this as an AED, you simply press analyze, and it's going to tell you what to do just like an AED does. So now we know the machine is ready and a shock is required because it tells us. You'll call your clear, you'll push,
perform CPR,
and there it talks to you just like an AED. If you want to use this as a manual defibrillator, which is what we do primarily here in the hospital, we're going to go ahead and stay at 200 joules and we're going to charge it. I know the machine's ready 3 ways. The light, the sound, and down here it says ready. Everybody's clear, push the button, and the shock has been delivered. Now that is for VFib and pulseless VT. If you ever have energy that you need to just dump because the rhythm changed or the patient's condition changed, you can simply change your energy and that gets rid of your live shock. Now, we have a patient who is now in this rhythm, which is VT. We have checked a pulse. We've touched our patient. They have a pulse. I do not want to throw unsynchronized energy at this patient or I am going to make their condition worse. They will soon not have a pulse if I did that. So when your patient is in VT with a pulse, you're going to go into the stop that rhythm section, and down here there's a little soft key that says sync on and off. You're going to press that soft key, and when you do, you change it from defibrillation mode into synchronization mode. And I know it's in that because 1, it says it, and 2, there's arrows that are coming down and indicating the QRS complex. This patient is not dead, so I have to be very careful where the energy falls on that rhythm to help the patient and not harm them. Your physician will determine how many joules you use. Typically in synchronized cardioversion, the joules are lower, so we're going to take it down to 100 and we're going to charge it. It says sync 100 joules ready, and then I'm going to push and hold just for a brief second so that the machine can find the right spot in the heart rhythm to deliver the energy safely. What you need to be aware of is when you're performing a synchronized cardioversion and an additional discharge is required, it automatically goes back to defibrillation. So if you need to synchronize cardiovert again, you have to manually hit that sync button and then it will come back on. Every time that happens. All right, so now we're going to talk about the pacer function of the defibrillator. Everything you need for the pacer set is down here in green, which means go. So you have a patient in a slow heart rhythm, whether that be sinus bradycardia or one of the blocks. For today's purposes, our patient's going to be in 3rd degree heart block. So we're going to turn this down to the green, the pacer section. When it comes on, it will say pace. It'll come up to 0 milliamps. Milliamps are the energy from this machine, and then the rate. It presets to 70, and the doctor will determine what rate he wants you to set it at. Typically, it's about 20% higher than what the patient's intrinsic rate is. For today's purposes, we're going to go over here to the dial that says rate, and we're going to turn it down to 60. All right, and if you can see, I have pacer spikes right here, but they're not doing anything to the patient because I've not told it to. So we've got the patient's rate set at 60, which is what the physician has ordered, and we're going to slowly start turning our milliamps up. And remember, milliamps is what's going to cause the machine to affect the patient, where it's going to cause that ventricle to contract, give that patient a pulse beat. Now I know the machine has done its job and captured because I have a pacer spike followed by a QRS, and that's a 1-to-1 ratio. I also know because the rate up here is what is set down here. And then I should just be continuing to monitor my patient, and I should see improvement in their blood pressure and their overall condition. Now, if your doctor comes to you and says, I want to see what the patient's doing on their own, please do not just turn this off, because that is detrimental to the patient. There is a small button down here, still in the green section, that says 4-to-1. If you press and hold this, you're going to see 4 beats of the patient's underlying rhythm to 1 paced beat. That way you don't have to turn it off and start all over again. Now, I told you in the beginning that some of the monitors have extra things and some have less. The monitors in women and children section, do not have any of the buttons, but when you turn the dial up, then it lights up behind the screen here, and then it will function as a manual defibrillator. So just be aware of that women and children's and recovery rooms monitors do look a little bit different, but once you turn them on, there's a soft key over here that says manual mode, and then it will look exactly like this. That's all for today. I hope this helps you.